Because now the issue of work for under 6 months has been put on the table.
The Ministry of Health hopes that by scaling up this program, they can significantly reduce malnutrition rates and improve the overall health of Uganda's youngest citizens.
And from the survey itself again, about 22 per 1,000 live births of infants die. And one of the factors could be to inadequate or poor nutrition or inadequate care. So in this initiative, we are focusing on active screening for malnutrition in these infants who are less than 6 months. And once they are screened and identified as malnourished or at risk of malnutrition, we want to intervene early and provide all the necessary care.
Rita Kabanyero, the country director for Action Against Hunger, emphasized the critical need to extend attention to children aged 0 to 6 months.
It's very appalling that 3 out of 10 of our children are stunted. Now the statistic is a bit lower, but it's still a very sorry state. Most of the focus and all the interventions that we have been focusing on 6 months to 59 months. And as a result, for these mothers that give birth to low birth weight babies, that give birth to babies who are at risk of malnutrition, we send them to the communities, and some of them have complications. They suffer from malnutrition and no one is following up. The statistics are not doing very well. Anemia rates are as high as 53%. And there are many other factors that are contributing to this. Some are as simple as feeding practices.
Addressing malnutrition in this age group is seen as a low-hanging fruit that requires immediate attention and resources.
And we've been implementing a pilot, focusing on this group of people, the children who are 0 to 6 months and their mothers, and ensuring that they go through a care pathway to ensure that they are not at risk of malnutrition. We are hoping that this can be scaled up to the other health facilities across the country, put into the national healthcare system, have indicators that are tracking this vulnerable group of people.
Over the past 3 years, this project has reached more than 30,000 children and their mothers, with 70% now thriving.
Themselves, for example, this particular group of children, 0 to 6 months, there are a number of policies, a number of interventions that are not focusing on them. And yet that if a mother is malnourished, they are going to give birth to a low birth infant or low birth baby. If you go to Toro, Chenjojo, we have a whole ward just to treat malnutrition, and the ward is full.
Crispus Arinitwe, UBC News.